chances are you've probably heard this a few times at this point, and if you haven't, well, you have not been paying attention. It is Medicare annual enrollment happening right now. If you have a plan within Medicare, you got to double check it, make sure it's right for you. Maybe you're aging in, you're going into this brand new world. How do you choose the plan that's right for you? Our next guest has some ideas for you.
That's right. In fact, he has a ton of experience and he's here to help. CJ Bowden, he is the Director of Government Programs at Hometown Health, joining us today just in from Reno. Great to have you.
Very nice. Thank you for having me today. I appreciate it, especially during this time of year.
Yeah, absolutely. Oh, it's critical. Listen, a lot of folks just think, oh, I'll just stay on the same plan as last year, knowing that they're not quite sure they're satisfied. So whether it's a senior themselves, their caretaker, a family member, sitting down to help make this decision, there's a lot of opportunities to see if your plan is right for you.
There is. Medicare plans change every year, and you have to understand what changed with your plan, if your providers are still with your plan, and what other benefits that are out there for you on a yearly basis.
Yeah, absolutely. Explain for those who don't know what Medicare is. I think people kind of from the outside looking in, they get confused with Medicare and Medicaid. What is Medicare?
Medicare is insurance for those individuals that are usually over the age of 65 or those individuals that have a disability. Medicare Part A covers your hospitals, Part B covers your doctor's visits, and Part D is easy to remember because it's your prescription drug benefit.
Awesome, CJ. And I was just going to ask you that. What's the difference between A, B, C, and D? Because, it's the kind of thing, if you're not on a plan, and even if you are, you hear these terms thrown around all the time. It's hard to, navigate if it's not a part of your career. So let's talk about some of the advice you give when people are approaching maybe reevaluating their plan.
On a yearly basis, the most important thing to do is look in the mail for that annual notice of change document. You can look at it and see what's changing with your plan. I know everybody's very excited to have as little change as possible,
Mhm.
but many individuals need to look at that and make sure that their doctors are still there, and then make sure the benefits that they need are still included in the plan, and most importantly, that all your prescription medications are included in the plan as well.
Mhm.
And then you can look at other plans that are in the market to help with that.
Yeah, and it's not just the plan changing that you have to keep mind of as well. Sometimes it's you changing. There could be health changes within you that involve you having to see different specialists or having to have other access to drugs or maybe doing other things that you have to keep in mind as well. Your plan that worked for you last year might not be the plan that works out for you this year.
And that's very important to note as well. With individuals, say you develop diabetes or COPD or congestive heart failure. If you get one of those type of conditions during a year or you're developing into that, then there's other plans out for you, like a special needs plan that will offer more benefits and are catered around caring for that chronic condition. So it's really important that you look at your health and make sure you have the plan that's best for you and your health.
Mhm.
Yeah, certainly. And that gives you, access to doctors when you need them. Because CJ, I know that one of the biggest frustrations for anyone with their medical plan is needing an appointment and not being able to get in and see a doctor.
That is absolutely correct. You need to make sure that the plan that you have, either your doctor's established, you're established with them, and that you can get to them on a timely basis. If not, when you're looking at a new plan, make sure that they have available doctors that are open to panel and make sure that you even give a call to some of the doctors and make sure that you're able to get in. Many of the plans, such as Senior Care Plus, also offer the opportunity when you first sign up to get selected with your doctor and make that first appointment right away so you know exactly when you're going to have your first appointment with your doctor.
That's great. And if we want to learn
Right.
more about Care Plus, where do we go for that?
The best place to go would be to seniorcareplus.com, or you can call our phone number at 775-982-3158 and talk to a Nevadan right here about your Medicare choices.
Fantastic.
CJ, thank you so much, and thanks for coming down from Reno. We hope we know it's snowing up there, so we hope you keep warm. And thanks for joining us today.
Take good care of the cannon. We'll be
Thank
taking
you
that
very
back
much for
next
having
year.
me. Oh, that's a
Yeah.
contentious point.
Yeah. Had to do it, of course. I don't care. I was not a rebel. Seniorcareplus.com. If you want to learn more about the great plan from Hometown Health, honestly, CJ is a great sport. We always love having him on. Hometown
Yeah.
Health and Senior Care Plus, a proud sponsor of the Morning Blend.